Now, out till today, the baby is dumb and dead. I just referred them to speech therapy clinic recently. And I start asking her question. And he said, because of what has happened in the past, how she's giving birth to dead baby. That is why immediately I told her she was pregnant, she was taking her go from Ikotu. And I said, you are the one who caused, very fine boy. You are the one who ruined the life of this child. Of course, for her to believe, when we were able to treat her, she got another pregnancy. We caution her, and that one is a girl beautifully doing well. No problem. So at times, in Kotanwa Losokoto, Akosokoto Lowa, we don't need to run up and down for unnecessarily to cause everlasting damages. Because any insult you take, this baby will shout of it in the first trimester of life. And the organs of these children are so fragile. They are sensitive. Don't be surprised. That's why you see some mother, they will take ordinary chloroquine. In fact, I've seen a mother, she took ordinary paracetamol and she aborted. She had a miscarriage. She lost the pregnancy. So the system is so fragile in these first 3 months of life that it can affect the organ of the baby or cause unexpected miscarriage. Then again, we often talk about some deceased entities. Thank God, with advancement of technology now, most of those things are gradually disappearing. And that is the more reason when you come for antenatal, they ask you, go and run your blood test. You say, you don't need it. Each pregnancy, you must run those blood tests. In each pregnancy, you must do them. Of course, if you come to my antenatal, even if you deliver, this is 2020. If you deliver 2019 and you bring another pregnancy, you will do all your blood tests. VDRL, HIV, hepatitis, because anything could have happened after that childbirth. And we don't want you to give it to the child unborn. So things like toxoplasmosis, syphilis, and rubella, all those things, German measles, they are things that are preventable, and we don't want them to affect the baby unborn. So the mother must endeavor to do those things. Now, even they have added Zika virus, which has just, that one was discovered in Brazil. But by migration, don't say one disease is in England, it can't happen in Nigeria. When coronavirus started in China, it was like joke. Today, we are living a life of fear. And then people should not be exposed to X-ray. If you are pregnant, tell your doctor. If you are having a complaint, or maybe chest pain, if you can still manage until after about 3 months and above, and if you must do an X-ray, let the radiologist know. There is a way they will cover the womb very well with lead material so that X-radiation will not affect the pregnancy. It is very important. Open up. Let the doctor know that you are pregnant. If there is a need for you to go and do X-ray in early pregnancy. And the radiologist must be carried along so that they know what dose of radiation they must deliver. Maybe don't say, it's chest X-ray they asked me to go and do. It's your entire body that is being exposed. So we must be very careful about this. So again, in pregnancy, it is not advisable to take alcohol, tobacco, or any hard drugs. All this, or even native concoction, as I've said earlier on, causes its own damages during pregnancy. And then the mother should be very careful of what they eat. Then visit your antenatal doctor regularly and listen to the health education. In fact, in my own little clinic now, if you come for antenatal, go to antenatal class first. Go and listen to health talk, ask questions. If there's anyone you didn't receive a satisfactory answer, then you can ask me when you come for your checkup. And your weight must be checked regularly. Unfortunately, in this part of the world, we take it with levity. I used to tell my nurses, take the woman to inner room where we have the weight scale. Let her remove everything. It's woman to woman. Because one thing that can be deceptive in weight is the dress you wear. Will not be able to assess whether the woman is gaining proper weight or not. If I wear a suit now, wear everything, remove my shoe, go and do my weight. You can't compare my weight with when I wear just knicker and a singlet. The cloth has a deceptive effect on weight check routinely. I say, take them to your inner room, go and do proper checkup. If your weight scale is 40, let us know. So it is very important we check the weight of the child, the mother regularly, and then give them head talk on how to care for. Some women are so dirty once they are pregnant. And believe me, during pregnancy is the time a woman should be more attractive to the husband. Dress very well. Make sure you are absolutely neat so that your husband will not even have the excuse of looking outside. But when you become so dirty because you are now pregnant, using pregnancy as an excuse, and your husband is even feeling reluctant to eat the food you prepare, it's a big challenge. And it's beginning of crisis even in some homes. They believe once they are pregnant, it's a license. There's no reason why what you do regularly with your husband before you got pregnant, you should not continue doing it again. There's no place where that one is acceptable. Then, we also now routinely, we have known that malaria affects the outcome of a baby in pregnancy. So, ideally, the mother must be treated for malaria once he has passed the first trimester of pregnancy. The modern school of thought believe in using sulfadoxine pyrimethamine once in a month. That is the one you call Fansidar. You just take 3 tablets once in a month. But what are people who have allergic reaction to sulfonamides? It is not advisable to take them. Some still believe you can take Sunday medicine, the one we call Daraprim. You just take that one once in a month. Even then, some school of thought believe that once the pregnancy advances, maybe at 7 months, 6 months and above, you can treat with ACT. That is artemisinin combined therapy. At least the mother must be well taken care of during pregnancy for malaria, because we know malaria during pregnancy for malaria, because we know malaria parasite crosses the placenta barrier and can affect the outcome of the baby. It can cause intrauterine growth retardation. So in our environment, that malaria, the unborn child. Then let us also remember that the mother must have 2 doses of tetanus vaccine. This is to protect the baby and protect the mother. Thank God in this part of the world, this one is being well orchestrated now, and people are key into it. I remember when I was in Lut. In fact, we have a neonatal ward for tetanus. We have a lot of tetanus cases coming all the way from Ajegunle, even Mushin and in Idiaraba, the slums. You just enter the ward, all those babies are neonatal tetanus. Because newborn baby, if the mother does not take anti-tetanus during pregnancy, he may go and deliver in the church. They may go and deliver in traditional birth attendant home, where the cord is mismanaged, or what they use in cutting the cord, the baby can easily come down with tetanus. So it's advisable that the mother must take 2 doses of tetanus toxoid during a course of pregnancy. However, if the mother is consistent and you don't move from place to place, it is believed if you can do a follow-up and take the 5 doses, even subsequent pregnancy, you may not need it. And that 5 doses comes, you take the first one, then at 0 month, 4 to 6 weeks after, you take the second one, 6 months after, you take the third one. If you stop at the third one, it is believed that you can only have immunity against tetanus for 10 years. That is provided you had the vaccine and you are immunized. Because let us remember, there is what we call vaccine failure. You may get vaccinated and not immunized. That is the mistake most of us make. And tetanus is such a funny organism that it depends on the dose of infestation. You may take tetanus vaccine and still come down with tetanus. But ideally, if one can endeavor to take 5 doses in sequential order like that, it confers a lifelong immunity. It will give the person a lifelong immunity. But I personally, I say, mothers can be very forgetful. The easiest way is each time they come for antenatal, let them take at least 2 doses of tetanus toxoid. And this also go for, in fact, the worst culprit are our men. Our men don't take vaccine. The moment they are one, they reach adult agehood, forget about vaccination for them. They don't take anything. They don't remember. And that's why you see some of them, when they come down with Okada accident, if the doctor didn't endeavor to give them vaccine immediately, don't be surprised. I've had a case like that, and the patient died. He had fatal Okada accident. They've managed the wound. The wound healed very well. About 10 days after, we only saw the scars of the wound. 10 days after, he came down with full-blown tetanus. And within 5 hours, he gave up the ghost. Because he was having, in fact, before we say, we cannot manage this one, no, take to note, it needs to be properly, before they reached that my junction, they came back. That's how bad tetanus could be. And it's worse for our men. Please, once your child is school age, go and give complete immunization of TT, 5 doses, especially to the boy child. It's very, very important. Let them start that immunization and complete it, because you don't know where you can find them tomorrow. Then during antenatal session, it's advisable you can do your ultrasound as the demand applies. For economic reason, if you don't have any indication, personally, I don't recommend ultrasound. But if I see any indication, my own concern is you are pregnant, you came, I want to locate the position of the pregnancy to rule out ectopic. And once I ascertain your pregnancy is in the womb, maybe by the time you are 5 months, I repeat my ultrasound and check, no placenta previa, no cause for alarm. Of course, unfortunately, majority of our women, they don't even believe there are other indications for ultrasound. Their indication is they want to know the sex of the baby. Which one can you manufacture? Which one can you manufacture? You that are asking for sex. I have had all guests, and we should be, I have seen it, I've experienced it. I'm very careful in telling you the sex of your child. I've seen somebody who had guess. Then the last one, I had a boy. And he was operated. And after having the boy, she was in the ward. She just shouted, when they break the news to her, thank you, Jesus, praise the Lord, shouted. And she went down and died. Yes. When ayọ̀ bá ti pọ̀ jù, wọ́n ní iṣẹ́ ń pààyàn, ayọ̀ ló máa ń pààyàn. So we should be very careful in telling patients this. And I've had one. She had 4 girls. She was trying to get a boy, and the last one was also a girl. And 8 days she ran mental. Yes, what we call puerperal psychosis, postpartum psychosis. So we should know when it is ideal to break the news of the sex of a child to a mother. So that's why, personally, I will tell you, what do you want to know? If you are sure of your date, yes, we can tell you when you are expecting your baby. We can tell you whether it's 1 or 2. But majority of our mothers are interested in the sex. And when they come to you asking for sex, ask further probing questions. Even, it's not only limited to maybe one having, we've seen men who has had 2 wives and is looking for a boy at all costs, and now married a 3rd wife. And the 3rd wife came to antenatal. The day you tell her that it's a girl she's carrying, she will not attend to that woman again. We've seen them. So we should be very careful when, how, and the time to tell them about the sex of the baby. And the other reason why we do ultrasound scanning is to know the mode of delivery. We all know if your baby is breech, if it's coming down with buttocks, especially if you are a first timer, The standard treatment now is elective cesarean section. Of course, majority of them run away to herbalist home and they meet their Waterloo. The reason why doctors these days do that is we are not just interested in you delivering a baby. We are interested in the quality of the baby. And the easiest and safest mode of delivery is cesarean section in a safe hand. Mind you, in a safe hand, not in the hand of a quack. So I will advise us as we attend antenatal, let us not listen to myths, taboos, or fake news. If there's anything you are not sure of, talk to your doctor and believe in your God and have faith for a successful outcome. So delivery depends. A well care for antenatal, we should expect a safe and sound delivery. When the labor is properly monitored, and don't let us start doubting. Of course, it's unfortunate. I don't blame some patients at this level. When a doctor pronounces cesarean, they say, God forbid, I reject it. In fact, you will see them, some of the women will stand up from the delivery couch and they will go to a church or a traditional birth attendant and have their baby. I will tell you, if a doctor genuinely pronounces cesarean, if you try anything otherwise, the person will regret it. But unfortunately, we talk of the business aspect of medicine. When they say that the family can afford the bills, they just push it to them. I personally, I don't believe in it. I don't do it. And I knew a doctor who doesn't greet me till today because of that. He called me for a cesarean in his hospital. I got there. I said, doctor, this woman can deliver. What is the big deal? Even if the worst comes to the worst, let's use a vacuum extractor. It was in his office, the clinic, the labor room was upstairs. Before he joined me, I've already delivered the woman. Normal vaginal delivery. No wahala. And he was mad at me. I said, it doesn't matter, you can still collect your fees. But the fact that we do surgery successfully does not mean we should overlook the attendant complication, which can arise even from the best hand. So he was annoyed. He was not happy with me. So we should be very careful about the mode of delivery because many children die in the process of childbirth. Some of them sustain everlasting injury. One was brought to me about a month ago. When I saw the child, cerebral palsy. That is my diagnosis. And they've been going up and down, herbalists, churches. And now is the father of the wife, the father of the mother of that child that came to me is my mechanic. I said, call the mother. The mother came, and I asked a simple question. I said, how long was your labor? Of course, the labor was unnecessarily prolonged. There is a common saying in the medical practice that the sun must not set twice on a woman who is in labor. That is, for no reason must a labor be more than 12 hours. Please understand that definition. It's not immediately you just feel some cramp. You run into the hospital, they start counting hours. When a woman is already in active labor, the sun must not set twice on that woman. You must intervene. And I asked the second question. I said, how soon did the baby cry? He said, in fact, the first day, the baby did not cry. They were battling. He said, did they give oxygen? He said, they don't have oxygen in that hospital. The brain has suffered anoxia. The brain, during that period, the child is not breathing properly, is not exchanging gases, and you are not there to give your own artificial oxygen to support the brain, or even do ordinary artificial respiration. I mean, in a hospital that does not have oxygen, we don't expect them to have ample bag. So that brain suffers irreversible damage. That is just it. And I told them, well, continue to treat and manage and pray. Things may change. The child will get the milestones, but they will be seriously delayed. That is just it. So it is often advised that a woman should deliver in the facilities where the antenatal care is done. And where it does not go that way, always make sure you have your record. Don't hide anything, because it happens at times. We just travel out of our station and we get trapped there. Always make sure you have your record with you and don't hide anything from the doctor who is taking delivery. So let us know adequate planning is a key. The evidence that all is well is usually a year that accompanies the delivery. After delivery, the next thing is breastfeeding. It's advisable now, within first hour of a childbirth, put the milk may not be coming out immediately. Just put the baby's mouth in the milk. Even during cesarean, we do it now. It's a bond. If you give a epidural, we don't have any reason to do general anesthesia. As we bring out the baby, the nurse clean the baby, give it to the mother to carry. That worm has its psychological and medical implication from the mother to the baby. No mother that wants to die, that will see his baby and will not have a change. So it's a psychological thing. Apart from the fact that the breastfeeding, it encourages early stimulation of the breast milk. That is a common saying in Yoruba. There is no condition a woman will be. If he hears the cry of the baby, he will have a rethink and wake up. So it helps to regulate the baby's temperature too, and exposes them to beneficial bacteria from the mother's skin. When we say beneficial bacteria, people will be worried, because all of us know and believe that bacteria causes damages or they are harmful. There are some bacteria that are actually beneficial. How are they beneficial? They help to develop the immune system. They stimulate the immune system so that the body can develop antibodies to fight against infection. So it protects the baby from infectious disease and help them to build their own immune system immediately. The recommendation is uninterrupted breastfeeding, at least for the first 6 months of life. But I wonder if you can do it now because of work. Work does not say you should not breastfeed your baby. If you are going to work, you can feed your baby in the morning before going, then express the breast milk in a warmer, which can be given to the baby at the stipulated time. But it is often recommended to breastfeed for at least 6 months, and then start the breast milk as early as possible. There is a segment of breast milk, the one that is called colostrum, which is the richest milk any baby must not miss. It contains all the antibodies to develop the immune system of that child. A baby must not miss that one. If you a nursing mother, you see that it comes out, it looks somehow yellow, like light milk, apart from the white milk that starts coming out later. That is the colostrum, which nobody should miss at all. Then we see the risk of infection is reduced. These days, majority of our children comes down with diarrhea, gastrointestinal illness, stooling and vomiting. Then again, we see that what we call allergic reaction. You see some babies, you will see their ears coming off. You see skin pawani ela. Of course, when they come to my clinic, the first question I ask them is, what artificial food are you giving? When did you start it? They start wondering, most of the cases are as a result of allergic reaction to the kind of food you give the child. Then we talk of middle ear infection, urinary tract infection, obesity in childhood and later in life, and respiratory infection. But if you key to breastfeeding, all these things, you just see your child thriving and growing normally, and you will not see most of these things. Then secondly, the risk of diabetes is removed, especially type 2 diabetes. You see some people becoming diabetic today. When you ask them, Baba mi ò ní, ìyá mi ò ní, mi ò mọ bí tí mo ti wá rí diabetes, food cancer. The breast milk is also protective against this. Then we talk of sudden infant death syndrome. This is not very common in our environment, but it do occur. I've had it in my practice before. That child, when he was born, we were insisting, give this baby breast milk. The mother was saying, "Oh, mi ò jáde lọ́yàn òun." In fact, before coming to deliver, she has already bought food. She didn't even ask us, and she bought the wrong food. And in the night, she opened. All what they after is when they deliver an average size baby, they want the baby to look plumping within a short time, and they start going to buy all sorts of food from discussion they have with their friends. And the baby was on the cot, and the mother slept. In fact, she didn't know the baby has gone. Baby has gone. What you call cot death was inside the cot, and the baby passed on. One, when you give them artificial food, you may overfeed them. Now, in an attempt, they regurgitate and can aspirate the food substance, and that is the end. The baby gets choked. It's an adult that will get choked and will try to cough, and from the cough, it calls for attention. You are able to assist, and they get to right. But newborn baby, they don't have all that experience and idea, and it can result in cot death. So that is why, even when you breastfeed your baby, you must wait, wean the baby, let the baby gas out before you go and lie the baby down. Not that you just finish breastfeeding, you go and lay the baby down. It's a dangerous act. So one must be very careful of that. We've talked about how it helps the baby to grow, then the psychological benefit, and then the skin-to-skin relationship with the mother. Then for the mother, what is the advantage of breastfeeding? Yes, you may be breastfeeding, and then the mother will start having cramps, pain, like menstrual pain. It is normal. It's just helping the uterus to go back to its normal size, what we call involution of the uterus. And again, it helps the mother to lose weight, because all the hormones you store during pregnancy, as you are breastfeeding, you shed off some of those hormones, and then the person regains its normal weight back. And then the risk of diabetes, especially mothers who have gestational diabetes. What do we mean by gestational diabetes? People who are not diabetics primarily. Then because they are pregnant now, as the pregnancy is going, you just discover that they become diabetic along the line. By good regular breastfeeding, such can easily be treated without much medication. And again, he said that it reduces ovarian cancer and premenopausal breast cancer. And then we also have what we call osteoporosis. This one we found mainly in elderly people who are aged, that the bones become fragile and brittle. And because of the low estrogen content, by breastfeeding, this one can be easily guided again. Then what else can we benefit from breastfeeding? When you breastfeed your baby, it's an economic advantage. If a bottle of NAN now goes for how many thousands? But by breastfeeding, you are not buying it. About 2,000, 3,000 that you are spending on breastfeeding, on artificial milk, can be used to provide food for the entire family within a short period. So let us encourage breast milk. Then decrease the risk of illness that results in reduced hospital admission. I've noticed that most of the mothers, once my babies come for immunization, I hardly see them again because most of them key to the breast milk therapy we encourage. Then environmental friendliness, no waste product at all. We stopping. Then when the baby is born, the neonatal period is what we are supposed to be discussing next. We have talked about exclusive breastfeeding as early as possible. Then cord care. We discovered that this is another area, baby that is likely to have G6PD deficiency. You'll be surprised. You can put the baby in trouble. He can hemolyze all the red blood cells. Then you can give the baby jaundice, which is another vital topic we are supposed to discuss, neonatal jaundice. Then avoid infections. Then immunization. These are the things we should be looking at during the neonatal period. But let me stop here and give room for questions. We don't know who may have one or two questions, please. And those of us listening to us, by the grace of God, on Wednesday, we have more time to discuss. As you know, we have just here. We cannot exhaust this wonderful topic even in a whole week, especially when you are teaching it to people who are not. Let me give room for questions. Yes, sir.
Praise the Lord. My own question is about the issue of the nursing mothers who will express their breast milk and put it inside the fridge. Is it advisable? That's the question, sir.
It's not advisable to put breast milk inside the fridge. It will congeal. It is advisable. Look, the one advantage of breast milk is direct from the mother to the baby. And that breast milk is coming at room temperature, maintaining the temperature of the child. It's not at frozen temperature. The moment you put it inside the fridge, you have already frozen the breast milk. The only thing that is advisable is if you get a good quality warmer, you can put the breast milk inside the warmer. It will not be hot, it will not be cold, and it will still maintain the same temperature with which it came out